Good morning, good afternoon, good evening, wherever you are. Welcome to another Answering Your Questions live. Ask me anything. And thanks for joining this call, and also thank you for watching it on replay if you're watching this on replay. Now, before we go into today's questions, what makes me qualified to answer your questions? So, my name is Patrik Hutzel. I'm a critical care nurse by background. I have been working in intensive care / critical care for nearly 25 years in 3 different countries. I have worked as a nurse unit manager for over 5 years in intensive care. I have been consulting and advocating for families in intensive care since 2013 as part of my intensivecarehotline.com consulting and advocacy service. And I can say without any hint of exaggeration that we saved lives with our consulting and advocacy. And you can see verification of that on our testimonial section at intensivecarehotline.com. And you can also listen to our podcast at intensivecarehotline.com with some client interviews that verify that we have saved lives, prolonged lives, gotten end of life situations on our clients' terms and not on the hospital terms. So I'm also the manager and founding director of Intensive Care at Home. With Intensive Care at Home, we have been operating for over 10 years in Australia. We are basically providing a genuine alternative for long-term ventilated adults and children with tracheostomies, but also for BiPAP, CPAP ventilation at home, tracheostomy care at home, home TPN, home IV potassium infusions, port management, PICC line management, central line management, Hickman's line management, also palliative care at home. Like I said, with Intensive Care at Home, we're operating all around Australia. We're also providing NDIS Level 2 and Level 3 support coordination. And you can find more information at intensivecareathome.com. Now, without further ado, I already have questions here. Modema, nice to see you again. I hope you're well, and thank you for joining. And Dare56 has a question and says, can a person from Glasgow Coma Scale 5 recover? What potentials are there? My mother is with a tracheostomy. She's in a coma since the 15th of February, and now she only opens her eyes. Cardiac arrest, hypoxic damage. Right. Okay. I'm very sorry to hear that, Dare56. 15th of January. Okay. So 15th of January. So we are now, today is the 25th of February in my time zone. So she's got a hypoxic brain injury. So Dare56, the question here is your mum potentially still sedated? That's one question, right? Is she still sedated? If she's no longer sedated, when did sedatives come off, right? Another question that I have, is she having seizures? If she's having seizures, she would be on anti-seizure medications, which also have sedative effects, right? Have you spoken to a neurologist? And what does the neurologist say? Have you seen the reports of a CT scan of the brain, of an MRI scan of the brain, of an EEG? Those would be questions that I would have for you before I can, really more succinctly answer your questions. You are also welcome to join me here on the call, and I will post the link here. If you would like to come on the call and talk to me directly, you can do so by clicking on the StreamYard link that I just posted in here. Anyone is welcome to join me here. Just click on the link and join me here, and then we can talk here. Now, then Dr. Adnan, what is the main point that we must know about COPD as doctors? Dr. Adnan, I am not a doctor. I have said that many times. I'm not a doctor. I am a critical care nurse. I can talk about COPD in intensive care and also with intensive care at home. I am less experienced when it comes to COPD sort of early stages. So, Dr. Adnan, you're more than welcome to ask me any questions that are intensive care related or intensive care at home related. General questions is not so much my strength. And like I said, I am not a doctor. You should be going to your doctor colleagues. My job here, as I see it, is, or my mission here is, as I see it, is to help families in intensive care. That is my mission here. And, you know, and that's all I have to say about that. There's plenty of information out there about COPD for doctors online, and I encourage you to look that. This channel here is to help families in intensive care. But thank you for joining, and thank you for asking questions here, you know. Okay, so while I'm waiting for Dea 56 to give me more information about her mother's or his mother's situation, you know, I will read out some questions that have come in during the week. There were plenty of them, but I also encourage you to click on the StreamYard. Okay, now Dea 56. She had seizures while they were trying to wake her up. The MRI scan has shown huge damage to her conscience. She now is breathing on her own with tracheostomy. She doesn't take medications. Well, she would be, okay, she doesn't take seizure medications, sure. She would take medications through either a PEG tube or a nasogastric tube, I would assume. But she doesn't take seizure medications. Okay. Okay. All right. So coming back. And now, yeah, now you're searching for a rehab center. Yeah. At Dare 56, where are you? Are you in the US? Are you in the UK? Are you in Australia? Are you somewhere else? If you can also share with me the country that you're in, and that will also help me to point you in the right direction. But to come back to your original question, can a person from a Glasgow Coma Scale 5 recover? I really don't have the answer to that. What I will say to you is this. Oh, you are German. Okay, well, I'm German. I could speak German. Ich könnte hier Deutsch sprechen, but our audience here is English. Okay, but that's great. If you are in Germany, then I can point you in the right direction. I have worked with intensive care at home in Germany. Okay, to come back to your question, original question. So yeah, no, I will keep talking in English here, of course. My audience is English speaking. But here's what I would do. Can she recover? I really don't know. Can she improve? Absolutely yes. Absolutely yes. Can she improve back to a GCS of 15? I very much doubt it, right? With what I know here. Have people recover to a GCS 15? In some instances, you know, but it can take time. A lot of it also depends, Dare 56, you know, what do you expect? Do you expect her to recover to a GCS 15? What is acceptable for you? What is acceptable for your mom, right? Where do you want to go from here? You know, do you want to focus on end of life because that would be your mom's wish? Do you want to keep going because that would be your mom's wish? Do you want to see how it's going, you know, in the next few weeks, months? And if it doesn't go in the way you want to see it going, you can still talk about end of life, you know, if that's where you want to go. Does your mom have an advanced care plan? Is it documented what she wants in a situation like that, right? So those are all the questions that I would consider asking if I was you. You know, people have recovered. Maybe they come back to a GCS of 10. Maybe they come back to a GCS of 12. Maybe they come back to a GCS of 15. How long will it take? I have no idea, but rehabilitation would be good. If she can't wean off the ventilator and the tracheostomy, there's no better country than Germany to take your mom home. I have worked with intensive care at home in Germany, in Munich, way back when, 20 years ago or so. And there are plenty of Heimbeatmungsservice in Germany, right? And you will find them in Bielefeld as well. So what I would do is I would start looking, you know, if your mom can't come off the ventilator and the trach, right, I would be looking for a Heimbeatmung service in your area, and there will be plenty of them. And most health insurances will pay for it. We wish at least to have a piece of her consciousness back to understand that I'm next to her. Sure. And that might take time, but this also comes back there 56 to, it's probably not a long time, and when was the last time she was sedated, right? Is she potentially in kidney or liver failure that will stop her from waking up because she still has sedatives and opiates hanging around her body, because they're not getting metabolized or excreted through either liver or kidney, right? And I understand it would be so good for you and your family to have her wake up and talk to her and say, hey, mom, what do you want? That would be the best case scenario. And maybe that is what you need to aim for, Dare 56. And maybe that is what you need to aim for, to get her to a point where you can talk to her so she understands what's happening, and then she can make a decision what she wants. That's really what maybe your short-term goal should be, to get her to wake up. And a lot of patients in ICU don't wake up quickly, with or without a brain injury, but rehabilitation is probably the next step here, and rehabilitation is the next step, and with the goal of getting your mum to a point where she can communicate with you what she wants, assuming she doesn't have an advanced care plan. That's what I assume she doesn't have, because otherwise you would be clear on what you want, on what she wants. You would be clear on that. Okay, but in the bigger scheme of things, they're 56. So we're now February 25. This happened January the 15th. I believe in the bigger scheme of things, this is not a long time. The other thing that I would strongly recommend to you is make a decision today that you don't regret in 12 months' time, in 24 months' time. So, it's very easy to make decisions today based on emotion, right? And then regret that in 12 months' time, because in 12 months' time, you look back on it and you think, oh, if I only had done this, if I only had done that, So you are saying she has over a week away from sedatives, but the danger now is she may get infection from bacteria. Yeah, for sure. So, okay, that's good information. Dare 56. 1 week of sedation, it's probably not a long time, especially with a brain injury. I would give it time. Give it time. Get her mobilized, get her physical therapy, get her out of bed, get her stimulated, and see how she responds, right? See how she responds. And of course, the risk for infection is huge in ICU or in hospitals, and that's why I'm saying you'll be so much better off at home. You'll be so much better off at home, and less infection, less bacteria, all of that, and you need to see whether rehabilitation is the best next step for her, whether someone will take her, right? And they may not want to take her with a GCS of 5. They may not. That's why it's so important that your next steps are mobilization, stimulation, physical therapy, and see whether she's waking up just by getting more stimulation. Imagine you're lying in bed for 5, 6, 7 weeks and you're not even sitting up, or you're just about sitting up, Very important that the next step is stimulation, and see what happens. That would increase her chances to get into rehabilitation. So, and then you're saying from the hospital, they're asking me what should they do in case her health gets worse. I told them to keep her alive by any means, and they judged me that it's not the best decision. Well, I've done a video, a live stream here, what about if the ICU is trying to guilt trip you, right? And I think that's what the ICU is trying to do here. They're trying to guilt trip you, right? Don't let other people tell you what's the best decision. You know your mom best, and you know what's best for your mom. You know what she would want. So don't let anyone guilt trip you. You know, they have a duty of care for your mom and for you. And like I said, in your mom's case in particular, you know, I would look at Heimbeatmungsservice in your area, right, in case she can't go to rehabilitation. I'm sure you have an interest to get her out of ICU as quickly as possible, you know. So, you know, yeah, have a look. There is a live stream, maybe from mid last year, mid 2023. I've done a video. What if the ICU team is trying to guilt trip you? So I encourage you to watch that, you know, and don't let their agenda be your agenda. You know, your agenda is different, you know. Yeah, no, you don't want to lose the live stream. And then Modema, you're saying if she isn't fighting the vent, that's half the battle. Yeah, look, it's different for different people, you know. I do believe that healthcare is not a one size fits all. It's about, you know, tailoring healthcare to the individual. You know, there are situations where someone might have told their family, hey, if I'm ever on a ventilator long term and I'm not waking up, I don't want to live. Just let me go. And that's okay too, as long as it's clear cut and people have voiced what they want. Now, Dare 56, you're also saying, also due to brain damage, she can't cough. She doesn't have the consciousness. That's the biggest danger of infection. Yeah, for sure. No question that if she's not coughing, you know, she is at an even higher risk of infection. But anyone in ICU is at a very high risk of infection because of, you know, the quote unquote infectious environment, of the quote unquote dirty environment with so many patients around that are infected, you know. But even if she wasn't in a hospital, if she's not coughing and she's on a ventilator with a tracheostomy, it's still a high risk of infection, because if patients are not coughing, they're at risk of a chest infection, you know. So, and that's why home care might be your best option, at least in the medium to long term, assuming she's not waking up and assuming she can't come off the ventilator and the trach. Now, and then you're saying, Dare 56, I have seen your video and you have helped me a lot. Thank you for your support. You're more than welcome. And if you want to, you can reach out to me. Go to intensivecarehotline.com. You can book a time with me there, or you can call me on one of my numbers. I am a German native speaker, so I can consult you in German. And I have done my basic nursing training in Germany. And like I said, I've end in Heimbeatmung, which is more or less intensive care at home, right? So more than welcome to reach out to me there. Okay, so let's move on to the next question. Like I said, if you want to join me here live and you have questions, you can go on the StreamYard link that I've just posted here again, or you can just type your questions into the chat pad and I will get to them. In the meantime, I will look at the questions that have come in during the week, or you can type them into the chat pad, or you can join me here on the StreamYard link and talk to me directly. I just posted the StreamYard link there. Let's look at what questions have come in during the week, questions or comments. There is an email from Glenn who says, hi, Patrick. My husband is 50 years old and overdosed on prescription pain pills. He had an anoxic brain injury. He was on a ventilator for 9 days. I was also told he was brain dead with no quality of life. They said when taken off the ventilator, he would pass away. We took him off the ventilator. I sat with him for 27 hours waiting on him to take his last breath, but I was talking to him saying, please fight and come back. At that point, he squeezed my hand. I had to fight to get him back on feeding tube and water. Then he went into a coma for days after moving him to palliative care. They again urged me to let him go. I refused. He woke up 1 week later and said my name. They removed the feeding tube and wanted to do a PEG tube to feed him. I asked for him to be checked first to see if he could swallow and to see what he could swallow. We are now in a skilled nursing home. He's improving slowly. He knows me. He walks slowly with support. My question is, how fast do you think he will recover? This is the love of my life, and I want him back. His memory is bad. He seems lost. Wow, Glenn, this is a great story. And you know, it also ties right in with what Dare 56 had to say. You know, like you were saying, how long will it take for my mum to recover? And then I see this email here. You know, I mean, that hopefully gives you some insights what other people are going through. You know, if he was on a had an anoxic brain injury and they wanted to let him go and he didn't go, right, because he was not ready to go, well, what do you do? And now all of a sudden he you know, he wakes up. Adam, I can see you're here. Adam, I can see you're here. I'll just answer this question and then I'll get you in. You know, just give me a minute. I'll just finish answering that question and then I'll get you here. So, you know, it's not a, that's why I keep saying healthcare is not a one size fits all. It is not a one size fits all. It is so uniquely different that you know, it is very, very different. And you know, if Glenn's husband come back, why can't your mother come back? Dare 56, you know. They were trying hard to let him go and he didn't. And maybe it's the same with your mom. They're already talking about letting her go, and maybe you shouldn't. And you know, and now how long is a piece of string? Well, he's shown Glenn that he can recover. You know, maybe it's the same here. Maybe your mother can recover. You know. So let's get Adam here. Adam has joined. Just bear with me. Oh, Adam has gone now. Okay. There we go. There's Adam again.
Hi, how are you, sir?
Hi. Very well, thank you. How are you?
I'm good. You know, there's good animations here. Like, can you see the animation here?
I can.
Because I'm using the iPad for iOS 18, that's why. So if I do the other animation here again? No, wait.
How can I help you, Adam?
Yeah, what are you doing? Where are you from?
Well, I'm based in Melbourne, in Australia.
Oh,
What
okay.
are your questions, Adam? How can I help you?
Yeah, I'm from London.
And how can I help you, Adam? Do you have any questions?
No
Okay. All right. All right. So let's go back to the email from Glenn. So, you know, they wanted to move her husband to palliative care, similar to Dare 56. You know, they wanted to move into palliative care, and he defied the odds. So Dare 56 with your mom only being out of a coma for 1 week, it's not a long time. You got to give it some time. And like I said, get her to mobilize. And the same with Glenn. You know, get your husband to mobilize. He keeps walking already. It'll be a slow but probably drawn out process, but you can see there is a process. Okay, so then Elisa says here, Patrik is correct. My mom is back in ICU from an infection of wounds at LTAC. I threatened a lawsuit to be transferred. Now she's in hospital and who has no wound. Doctor, how can I get her transferred? My mom is back in ICU. I threatened a lawsuit to be transferred. Now she's in a hospital who has no wound. Doctor. Right. So where do you want her to go, Elisa? Do you want her to go to another hospital, or what would you like? What would you like there, Elisa? If you can help me, what you are trying to achieve. So you want her to another hospital, okay? Do you have a hospital of your choice that you know where you would like her to go to? Because if you know where to go to, then you should contact that hospital and see whether there's appetite to take her. Okay. First question here, Lisa, is has she been a patient there before? Because it'll be so much easier if she has been a patient there before. They would have her on file. It's more likely for her to get there. Right? There's with specialists. Okay. Has she been a patient there before? Okay, she hasn't. That's okay. Do you know anyone there? It's often, sometimes it's who you know, not what you know. Do you know anyone there? Doctor, nurse, anyone? She was at another hospital. Yeah, I get that. My advice here is if you don't know anyone, okay, that's okay. If you don't know anyone there, my advice is to contact them and see whether there's appetite to take her. If they have appetite to taking her, I would talk to the hospital your mother is currently at and get the ball rolling. It's no more complicated than that, right? That's what you should do. What do you want from the specialists there? What specialists are you looking for? What specialist care are you looking for that she's currently not getting? That would be my question. They're trying to send her to sniff. Yeah, I get that. Yeah, that would be terrible. To see a wound specialist. Okay. Yeah. Okay. So another question here is, besides not having a wound specialist, do you think your mom is getting what she needs where she is right now? Right? Because if you're happy with everything else, can they get a wound specialist to her current place, to wherever she is at the moment? It's probably easier to achieve that rather than going to another hospital. If you are happy overall, get a wound specialist to see her there. That's probably easier than doing a full transfer. And as we all know, going to SNF is worse than LTAC. LTAC is bad, but SNF is even worse. Is your mother still ventilated with a trach, Elisa, or from an infection? It's not clear to me. Is she still ventilated with a trach, Elisa? Okay, while I'm waiting for Elisa, I'm going to the next. They want to let her perish. She's still trach. Yeah, no, I get that. I really get that. They want to let her perish. I get that. And you need to then potentially send her to another hospital if you feel that way. You need to send her to another hospital if you feel that way. If you are saying they want to let her perish, does she have a DNR? Do you know what I mean with a DNR? Because if she has a DNR, I would revoke that as a next step. I would revoke that as a next step if I was you. Right? Because what does it mean? No, she's full code. Good. Keep it that way. So if she's still having a tracheostomy, is she also ventilated? I just don't care. Yeah, that's terrible. That is just terrible. I'm very sorry to hear that. Very sorry to hear that. Yeah, then you will need to look at other options for sure. So that's what I would do then, go to another hospital. You may have to try more than one. She's progressing otherwise. Okay, all right. Well, that's good. If they can wean her off the trach there, if you have confidence that they can wean her off the trach, then just get a wound care specialist to where she is now, and as long as they are progressing, or as long as she's progressing, that's good. And don't let them threaten you with sniff. Put the onus back on them to get them to remove the trach, and then you can hopefully get her home after she has the trach removed. After she has the trach removed and after the wounds are healed, get her home. I would hope that might be your goal. So yes, of course you want her home, but taking her home without a tracheostomy will be so much easier. Taking her home without a PEG tube will be so much easier. Can they do that there? Can they move her forward to that point where she can go home without a trach, without a PEG, fully mobile? Can they start rehabilitating her? Is she walking? Is she trying to talk? Is she trying to eat and drink? Because you and I know that if she's going back to sniff, it'll go downhill very, very fast. You've seen that it went downhill when she went into LTAC. It'll be worse in sniff, right? It'll be much worse in sniff. She's swallowing great. Yeah, it'll be horrible in sniff. Just focus on moving her forward where she is right now. Focus on that. Okay, let's go to the next question that has come in during the week. In the meantime, type your question into the chat pad. Yes, Elisa, don't go to LTAC. Yeah, unfortunately, that is what it is. Don't go to LTAC, let alone sniff. There's a cascade of horror. Once people leave ICU, the first cascade of horror is LTAC, and then it's sniff. It's going worse as you're going along. Anyway, wishing you all the best, Elisa, and you know where to find me if you need more help. You can just go to intensivecarehotline.com, call me on one of the numbers on the top of the website, or you can also book a time with me for another 15-minute free consultation if you're going to the schedule appointment link on the website. Okay, next question here from Jacob, who says, hi Patrik, the doctors are trying to rush us to make a decision on my wife in ICU. Okay, we get similar questions all the time, and this is, my answer to this is don't rush. Whatever the decision is, don't rush unless it absolutely saves your life's wife. But often the decisions in ICU where families are being pressured are around, pulling life support, pulling the plug, being forced to do a trach. And, there are time windows that need to be adhered to when it comes to doing a trach. However, before you're even going there, you need to ask the question, are they doing everything beyond the shadow of a doubt to get your wife off the ventilator and the breathing tube and avoiding a tracheostomy? If this is potentially an end-of-life situation, Jacob, you also need to work out, are they doing everything beyond the shadow of a doubt to help your wife to stay alive? Right? Those are the questions you need to ask. And I mean, we've just had this email from Glenn, telling us about a remarkable turnaround where, ICU wanted to kill her husband, and now he's talking, he's walking, basically telling her he will never recover, and then he recovers. Right? So there are certain situations where timelines are important to make a decision, but you shouldn't make that decision, Jacob, without a second opinion. You need a second opinion when it comes to life or death situations. When it comes to situations you don't understand, you don't have enough knowledge about. Once again, the biggest challenge for families in intensive care is simply they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights. They don't know how to manage doctors and nurses in intensive care. Dare 56 is saying, I'm also in doubt about how they're trying to help my mom in the hospital. So look, they're 56. Here is what I understand about your mum's situation. I'm just trying to scroll back to your original comment, but here is what I understand about your original situation. Your mum is stuck in ICU. She's had a cardiac arrest. She's got a hypoxic brain injury, right? She's ventilated. She's got a tracheostomy. Now you're looking for rehabilitation. Can she recover from a GCS of 5? Again, I don't know. I don't have the answer, you know. However, you know one thing for sure: if you're giving up, you know the outcome. If you're not giving up, you don't know the outcome. So you will need to be able to embrace uncertainty, right? Which is, once again, easier said than done. So what would I expect from the hospital to help your mum? From what I know about your mum, what I would expect them to do is starting the rehabilitation process early, get her out of bed, start mobilizing her, do physical therapy, right? Ideally start some ventilation weaning if it's possible at all, right? I don't know whether ventilation weaning is possible for your mum or not. I don't have enough information, right? But the sooner she can go to rehab, the better, right? Another thing you got to look for is if she can go to a long-term weaning unit, like in German, that's Langzeitentwöhnung, right, off the ventilator. So you can look at that, whether she would qualify for that, right? So there's a number of things you can do. There's a number of things you can do, right? Okay, so next question that has come in during the week, but feel free to type your questions into the chat pad or join me here live on the show. If you have questions related to intensive care, join me here on the show, and we can ask questions here, or you can ask questions here and talk to me. So next question that has come in from Stuart during the week, who says, what can be done after 30 days on a ventilator? Well, that is a great question, Stuart. Well, in a nutshell, I presume you are referring to someone who's on a ventilator with a trach, right? Because after 30 days on a ventilator, your loved one should have had a trach, right? If your loved one hasn't had a trach after 30 days, they probably do need a trach, right? Tracheostomy. But I presume your loved one has a trach. I presume they can't be weaned off a ventilator. That means they need to do some weaning, right, if they can. A lot of it depends on the underlying condition. You know, is your loved one having a pneumonia? Are they having ARDS? Are they having a spinal injury? Are they having any other form of disability? You know, so a lot of it depends on that. And what else can be done on a ventilator after 30 days is a weaning regime, a weaning plan, right? And number 2, like I said, mobilization, stimulation, physical therapy. And then if all that doesn't work and you're sick of being in hospital, quite literally, you know, your loved one has no quality of life, you probably have no quality of life, you know, look at intensive care at home, right? Look at intensive care at home, go to intensivecareathome.com. With intensive care at home, we can help you take your loved one home from ICU and bring the ICU into your home, right? So, you know, that's a win-win situation. It improves quality of life for you and for your loved one. It frees up an ICU bed that's in demand, and it costs about 50% of an ICU bed. Once again, it's a win-win situation, right? I'll be back on camera in a minute. So that's what I would strongly recommend here if weaning in the hospital is no longer feasible, right? Other things that you should be looking for is your loved one still on sedation? You know, are they needing to get off sedation first? You know, again, the biggest challenge for families in intensive care is that they don't know what they don't know. You know, have you had a second opinion? Because we would love to give you a second opinion here, but I would either need to talk to doctors and nurses directly, or I would need to talk to doctors and nurses directly, or look at medical records. You know, either or. You know, with intensive care at home, you know, we can wean your loved one at home. There's no need to stay in ICU for weaning. There really isn't. You know, just some thoughts for you. You know, but with intensive care at home, weaning can be done at home. It improves the quality of life for your loved one. It improves the quality of life for you as a family. You know, it frees up an ICU bed. It cuts the cost of an ICU bed by 50%. Win-win altogether. Everyone is winning with intensive care at home, right? So, and imagine your loved one stuck in ICU in a sort of sterile, non-family friendly environment. How much more likely is it that your loved one will wean off in a more family friendly environment than it is in a hospital environment? You know, much easier to do that at home, especially after such a long time in ICU. You know, Modema, you're also saying stimulate her, play music, set up photographs, talk to her there. Yeah, absolutely. Normalize as much as possible. Normalize as much as possible. You know, you can never go wrong by trying. You know. Okay, so let's move on to the next question. From Ola. Before I go to Ola, Dare56 has another comment. I am understanding that they want us to leave. They also have told me they can't do anything else. I'm going to see her and they come after 1 hour. I think they don't take care of her properly. Right. That would certainly be a concern for sure. Well, if they want you to leave, really your options here are, again, like you identified correctly, either rehabilitation for long-term ventilation and neurology rehab, or, you know, if for whatever reason she can't recover, or they think she can't recover, you obviously need to make your own judgment and then potentially look at Heimbeatmung, intensive care at home. Right. I'm talking about the doctors. Yeah, no, I get that. And they might not be able to do anything else at this particular point in time, including weaning her off the ventilator and the trach. Maybe that they can't do it. Right. Not at this point in time. You know, you may need some time. Okay, let's just quickly go to the next question. And I encourage you in the meantime to type in your questions or join me here live on the StreamYard. Dare56 says, I made a mistake before. She has 3 weeks away from sedatives. They had arranged for Thursday to remove the tracheostomy, but she had a fever and they stopped it. Okay, Dare56, I argue that if your mum is unconscious with a hypoxic brain injury, if they were to remove the trach, right, she would die of an aspiration pneumonia. If she has a GCS of 5, which is what I believe you said in the beginning, I argue she would die if they removed the tracheostomy. Right? I also made a mistake before. She has 3 weeks away from sedatives. Or are you talking about there was a delay in doing the tracheostomy? Is that what you're referring to? To remove the tracheostomy? No, to remove the tracheostomy. Now, I understand they wanted to remove the tracheostomy. With a Glasgow Coma scale of 5, she will die if they remove the tracheostomy. And if she's ventilated, how would they ventilate her without the trach, with a Glasgow Coma scale of 5? How would they do that? It ain't going to happen. Okay, she has a tracheostomy and they arranged for Thursday to remove the tracheostomy. She's going to die with a Glasgow Coma scale of 5, removing the tracheostomy. Does that make sense? If she's ventilated and has a tracheostomy, and they remove the tracheostomy with a Glasgow Coma scale of 5, she's going to die. She is going to die. Steps are for someone that's ventilated with the trach. You remove the ventilator first, and if your mom can breathe, then you can remove the tracheostomy, assuming she can swallow, assuming she can cough, you know. She's with oxygen, okay. Yeah, but she's with oxygen on a ventilator. If she's on a ventilator with a trach, she will die if you remove the ventilator, if you remove the trach. Unless there's something that you haven't shared, but I doubt it. And this is why I say the biggest challenge for families in intensive care is simply that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights. They don't know how to manage doctors and nurses in intensive care. That's exactly what you are dealing with here. Once again, you know, and they can't just remove her from the ventilator and the trach and let her die without your consent. Okay, so I hope that clarifies here. I would object that if I was you, day 56, unless you think that is your mom's wish and she wants to have the ventilator and the trach removed and potentially pass away. I see, she has a tracheostomy with oxygen therapy, so she's not attached to a ventilator. Okay, I see. Well, okay, if they want to remove the tracheostomy, day 56, your English is great. I can understand everything you're saying. I think you're just not clear about the medical terminology. I think that's what it is. It's not your English. I think it's more about that you don't quite understand what they're doing clinically. Right? So if she's off the ventilator with the trach, right? She's got the trach, she's got oxygen. So if she's awake, she can swallow, she can cough, right? That might be when they can remove the ventilator. That might be when they can start removing the trach. Is she coughing? Is she swallowing? Those are the two questions, most important questions to remove the trach. Right? Have they done a swallowing assessment, and can she cough? Right? Can you answer that question? Is she swallowing and is she coughing? That is the most important question here. Right? Because if she can, that's when they can start looking at, she's swallowing, but she's no coughing due to her unconsciousness. Okay, all right. Well, if she's not coughing, she will need the trach to suction her sputum, her secretions. It's a no. If she's not coughing and she has the trach and they would take her out, she will drown in her own secretions. Right? She will drown in her own secretions. Okay, so you need to be very clear here about what the next steps are. I think you've got some gaps here in your knowledge. Yes, absolutely. She will drown in her own sputum with the tracheostomy removed if she's not coughing. Imagine you're not coughing. Well, you will drown in your own secretions, right? Sooner or later. Sooner or later. You got to look out for how often do they suction her. You know, how often does she need suctioning and how much is coming up? Keep an eye on that. You know. So another question from Nidia, who says, "Hi Patrik, I feel like the doctors are trying to get rid of my mum in ICU." Well, I can understand that, and I can understand that's how many patients and families feel in ICU. I mean, that's just what their 56 are saying, that I think they want to get rid of my mum. And I think it's the same here, Nidia. Well, once again, you should trust your gut feeling. Your gut feeling is telling you they want to get rid of my mum. And what you need to do here is stand your ground, get a second opinion. You know, with emails like that, I can see that that what I'm saying, that families in intensive care don't know what they don't know, is exactly right, because otherwise you would give me more context. I'm trying to answer those questions as best as I can. There's not enough context, right? And the context is that ICUs are stretched. ICUs are they're stretched, they have limited resources, and they also want to have a high patient throughput. Their worst case scenario is to look after someone indefinitely with an uncertain outcome. Okay, I'll just delete some inappropriate comments here and ban the users. Okay, so okay, there's a comment I was sounding a few days ago and now it hurts to urinate. Again, I am here to help families in intensive care. I am not here to give individual health advice. I'm helping families in intensive care here. That's my job. So if you have questions about your own medical condition, you should see your family doctor, your GP, or get a nurse on call. You can also call me after this call if you wanted to have a nurse consultation. I can certainly do that for your own condition. Okay, so then let's go to the next question. Let's go to the next question from Pamela. Pamela says, I get conflicting information for treatment about my dad in ICU. Okay, great. So what you should do in a situation like that, Pamela, is once again, you should also get an outside opinion. You should get a second opinion, right? So with a second opinion, you can, yes, you say you don't want another opinion, but the reality is the dynamics in hospitals can be very complicated. They can be very political, hierarchical. Intensive care teams often have a different opinion compared to the specialists, such as a neurologist, such as a surgeon. I can understand why you would get conflicting information from intensive care teams. Other things that happen in ICU is, the consultants are usually are on duty for about 7 days. Then the next consultant comes in, sometimes they change every 3 or 4 days. Yes, you would see different opinions and you would also see different approaches, and that can be very confusing, right? But again, that is where I can help as well. We would be looking at the medical records and we would be, giving you an objective point of view. When you get different opinions, it's not necessarily objective. It's very subjective and you hear different points of view. And, the best thing that I can do here is give you a crash course in intensive care. You know, that's the best thing that I can do and help you to ask the right questions. So, you know, you're also getting different conflicting opinions potentially because you're not asking the right questions. You know, that's also part of the issue here. You got to ask the right questions. Right? Okay. Okay. So please keep the questions on the intensive care topic. If you have a loved one in intensive care, please keep the questions on that topic and make it very specific about intensive care before we wrap this up today. So I am going to wrap this up in a minute. If you have any other questions in regards to intensive care, if you have a loved one in intensive care, please type those questions in now. Alternatively, I'm going to wrap this up in a minute. So if you have a loved one in intensive care, if any of you have a loved one in intensive care, I encourage you to reach out to intensivecarehotline.com and call us on one of the numbers on the top of the website, or send us an email to support@intensivecarehotline.com. We also have a membership for families of critically ill patients in intensive care at intensivecarehotline.com by clicking on the membership link there, or go to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in the membership area and via email, and we answer all questions intensive care related. Now, I also offer one-on-one consulting and advocacy for families in intensive care. I talk to doctors and nurses directly, and I talk to you and your families directly. I offer one-on-one consulting over the phone, Zoom, Skype, WhatsApp, whichever medium works best for you. And I talk to you and your families directly. I talk to doctors and nurses directly. And I ask all the questions that you haven't even considered asking, and it will change the dynamics for you. You know, I've worked in intensive care for over 20 years in 3 different countries. I have worked as a nurse manager for over 5 years in ICU. And we have saved lives with our consulting and advocacy since 2013 at intensivecarehotline.com here. And, you know, we can do the same for you. We also offer medical record reviews in real time. We also offer medical record reviews after intensive care, so that you can get a second opinion in real time or after intensive care, right? I also represent you in family meetings with intensive care teams, right? So that you have representation there, but I also strategize with you whether you should even go into a family meeting with intensive care teams, right? Sometimes it's not the right strategy to go to intensive care, to go into family meetings with intensive care teams, right? I also would welcome, give me a like for this video, subscribe to my YouTube channel for regular updates for families in intensive care, and subscribe to my YouTube channel. Comment below what you want to see next, what questions and insights you have for families in intensive care. And click the like button, share the video with your friends and families. And also have a look at intensivecareathome.com and get intensive care at home there. Once again, we're operating all around Australia with intensive care at home. We provide level 2 and level 3 NDA support coordination. We send you critical care nurses into the home for long-term ventilation with tracheostomy. And thank you so much for watching. I will be back again here next Sunday, 10:30 a.m. Sydney time, Melbourne time, Saturday night, 6:30 p.m. Eastern Standard Time US, 3:30 p.m. Pacific time in the US. I'm looking forward to seeing you there. Check out our quick tip videos that come in during the week. And thank you so much for watching. Take care for now and have a great week. Take care.